You know, look at what we have been able to do and how it will change the future of healthcare. Look what we did for our seniors in Medicare. Medicare is a lifeline for our seniors in healthcare. Extended the solvency for another decade. You're talking about what we did as far as dealing with costs and financing. We brought down, we extended Medicare for another decade. It's a pretty good job to get done. And then we expanded benefits. We're going to get rid of that coverage gap on prescription medicines. There's seniors in our community who fall into this coverage gap. They have to leave their pills at the pharmacist because they can't afford it or cut pills in half. You know it. You've seen this happen. Well, we're going to get rid of that thanks to the Affordable Care Act. We got that done. I was with a family last week who said, thank you, thank you. I said, what do we do? I have a 24-year-old son. He's now on my insurance policy. It's a big deal. It's a big deal. You know, our children don't become automatically independent when they graduate college or high school. They still need our help, right? Amen. We recognize that. You know, in one area, they're not terribly expensive, and that is keeping them on our insurance. It costs a lot of money because they're at a healthy age usually. But they need the insurance in case. And we've now done that, got that done. I talk to small business owners who say, look, we want to do what's right for our employees. But why are we paying more than larger companies for the same coverage per employee? Well, we changed that. We now are going to have competitive rates for small companies so they can get a plan that's right for them. We listen to individuals who say, look, I would like to have insurance, I can't afford it. We now made it affordable for all families to be able to have insurance. And we looked at the abuse of the practices of some insurance companies. There's some insurance companies that literally said, under a pre-existing condition restriction, that means they're not going to cover you if you had certain pre-existing conditions. Some insurance companies were saying, if you're a woman and you had a baby, that's a pre-existing condition. That's just outrageous. So we have changed the landscape here. And we did other things that are important. We invested in prevention and wellness because we've got to get the cost of healthcare down. We invested in technology, and I see the technology being used here at this facility. We invested in that. We invested in ways to bring down costs by getting everyone covered so we don't have uninsured. Now we're going to have some, but this bill will cover another 30 million. That's a pretty good number to get in the system. So we've made a lot of progress, and I am proud of the role that our delegation played. Bill mentioned the tragic loss of the Monty Driver, a 12-year-old who lived literally within miles of where we are right now, very close by. He had a toothache. His mom tried to get him to a dentist. He had no health insurance. People say, what's the big deal on toothache? You know, you're supposed to have pain. Deal with it. And his tooth became abscessed, infected, went into his brain. And what should have been an $80 dental care cost ended up being $250,000 of operations. And he lost his life. Well, we took action. Said, never again are we going to have another Damani driver. Another child who will lose his life because he can't get care. So I drafted an amendment to the Children's Health Insurance Program that said every child in America will have guaranteed access to dental care. That's now the law of the land. We expanded that into the health reform bill. So we now also have websites for parents to get information. Thank you for taking care of the DeMonte Driver. The DeMonte Driver Dental Project now has vans to go to our schools. I was with an 8-year-old just this past week in one of the schools with one of the vans, teaching her how to brush her teeth. I was asking her a question about brushing your teeth. And I said, how long do you brush your teeth? She said, wait a minute, You got to do more than brush your teeth. You got to brush your gums and brush your tongue. She understood. They understand. They're teaching us. And that's the way it has to be. We're making progress. I drafted part of that bill that establishes now the National Institute for Minority Health and Health Disparities at the National Institutes of Health. This is a full institute. And I've talked to Secretary Sebelius. I've talked to President Obama about this. We now have a national commitment to say, why do we see more fatalities among African Americans with heart disease than the non-African American community? Let's find out why. Let's get the answers to some of these issues. So we've made a commitment to eliminate the disparities in healthcare in this country. And we now have a full national institute to do it. We're making progress. I guess my point to you is this. There are a lot of people that are upset today, and I understand that. This economy's not where it needs to be. We've got to create a lot more jobs. I agree with the president. We've got to create more jobs. More people got to be working. We turned things around from losing jobs when President Obama became president to creating jobs. We've got to do a better job. But we've made some progress, and let's make sure we don't turn back that progress. Because there are some who say, let's repeal everything we did on the health care bill. That's not an idle threat. It passed the House of Representatives. It passed. Now, we stopped it in the Senate. But let's not turn back the clock on the progress we've made in health care, the progress we've made on women's rights, the progress we've made on civil rights, the progress we made on workers' rights. On workers' rights. Thank you. One of our Ms. Rivers, one of our real leaders here with 1199, and thank you for what you do on behalf of workers in our community. I'm proud to stand with you.